Hello, my name is Matt Ragoza, and today I'll be talking about my research project on physics-informed neural networks applied to tissue elasticity reconstruction in magnetic resonance elastography. Tissue elasticity is an important early indicator of diseases, including liver fibrosis, breast cancer, and more. Liver fibrosis is a progressive condition that is reversible with early detection, and tissue elasticity can be used to stage fibrosis with over 90% accuracy, making it an extremely useful tool for improving clinical outcomes. Elastography is an imaging method for non-invasively measuring tissue elasticity. It involves 3 steps. First, we apply a mechanical stress to stimulate motion in the tissue. Next, we use a specialized motion-encoding magnetic gradient to measure the tissue displacement. And finally, we apply an algorithm to reconstruct elastic parameters from the measured displacement data. Elasticity reconstruction from displacement data is considered an inverse problem that involves solving a partial differential equation, or PDE, derived from physics. Specifically, we are given samples of the displacement field, U, and the goal is to solve an equation for the elastic modulus field, mu. The exact form of the equation depends on the specific set of physical assumptions that are used. It's common to assume that liver tissue is isotropic and linearly elastic. Other assumptions, such as incompressibility and local homogeneity, simplify the equation even further. Regardless of the assumptions chosen, numerical methods such as finite differences or the finite element method are typically used to solve for elasticity from displacement. However, these numerical methods are sensitive to noise and physical assumptions, and they do not have the ability to learn from anatomical images. In this work, we used physics-informed neural networks to solve the inverse problem of elasticity reconstruction. Physics-informed neural networks, or PINNs, are a method that uses neural networks to solve PDEs. A PINN is a neural network that learns a mapping from coordinates in some spatial domain to physical values in that domain, such that a partial differential equation is satisfied. We trained 2 PINNs to learn continuous representations of the displacement and elasticity fields for a given patient. One neural network learns a mapping from spatial coordinates to displacement vectors and is trained to match the displacement data that was measured using a mean squared error loss function. In effect, this network learns a continuous and differentiable representation of the wave image. Then a second neural network is trained simultaneously to learn a mapping from spatial coordinates to elasticity field values. This network is trained by optimizing the residual of a chosen partial differential equation from physics. As training proceeds, this second network slowly recovers the latent elasticity field from the measured displacement image data. To incorporate anatomical images, which we represent by the variable A, we also try using an additional output head from the elasticity model that predicts the anatomical image features at the corresponding location. We evaluated our method on 2 different data sets. The first was an FEM simulation of 4 stiff targets in a box region. The simulation produced wave images at 6 different frequencies, and we applied reconstruction methods to each wave image and compared the results to the ground truth elasticity. Next, we evaluated a data set of medical images from 155 patients with non-alcoholic fatty liver disease. Each patient in this data set had liver segmentation masks, several anatomical image sequences, and MRE data. We applied reconstruction to each patient's wave images and compared the results to the gold standard elastography, which was obtained from a proprietary algorithm from the MRI scanner. When we compared our method to these several numerical baselines using the simulated dataset, we found that PINNs were more robust to noise than the baselines. As the noise level increased, the reconstruction quality deteriorated quickly when using the numerical methods. But PINNs were robust to over 100 times the amount of noise that caused the baseline methods to fail. Next, we compared the reconstruction methods on in vivo liver data and contrasted their performance against the gold standard elastography. On this dataset, the PINNs were more accurate at reproducing the gold standard elastography than the baseline methods, and PINNs were especially accurate when the true stiffness values were near the lower threshold for fibrosis, which is an important feature for early detection of liver disease. Finally, we tested the effect of incorporating anatomical images during PINN training. We found that there was a significant positive effect on the reconstruction quality when we trained the PINNs using the anatomical images. This means that the PINNs were able to learn additional helpful information from the anatomical images beyond prior knowledge from physics. We believe that this shows that complementary benefits can be gained from combining physical prior knowledge with data-driven machine learning, and we will explore this research direction further in future work. Thank you for listening. The code for this project is available at the GitHub link below, and please feel free to attend my full talk and speak with me at my poster presentation during the conference this week.